Clearing the air, the harsh reality of nicotine addiction. The allure of tobacco has been a seductive force for centuries. The sweet-smelling smoke and the calming effects of nicotine have captivated people from all walks of life. From royalty to farmers, from celebrities to factory workers, tobacco has been an equal opportunity vice. But with the passage of time, we have come to realize the harsh reality of tobacco consumption. The use of tobacco products is the leading cause of preventable cancers, resulting in around 5.4 million deaths per year. Nicotine, the addictive component of tobacco, has been a focus of research for many years. As we continue to learn more about the effects of nicotine on the human body, we have discovered that it poses several health hazards. Although nicotine is found in various forms such as cigarettes, gums, patches, and e-cigarettes, its systemic side effects are serious and can lead to several health hazards. The purpose of this study is to evaluate the adverse effects of nicotine on various organ systems. As we explore the findings of this research, we will delve into the chemical properties of nicotine, its metabolism, and its mechanism of action. We will also examine the immediate effects and toxicity of nicotine and how it leads to nicotine addiction. We will explore the effects of nicotine on metabolism, including how it increases the risk of metabolic syndrome and diabetes. Additionally, we will examine the links between nicotine and cancer, exploring the role that nicotine plays in the formation of carcinogenic substances. Furthermore, we will explore how nicotine affects the cardiovascular, respiratory, gastrointestinal, renal, ocular, and reproductive systems. The effects of nicotine on each system are complex and interconnected, leading to several health hazards. It is important to understand the effects of nicotine on each system so that we can take the necessary steps to protect ourselves from the risks associated with its consumption. As we delve into the research on nicotine, we will explore the history of tobacco and its use throughout the ages. We will examine the international treaty aimed at reducing the production, sales, and promotion of tobacco products, as well as the growing demand for cessation. Furthermore, we will examine the use of nicotine preparations such as gums, patches, e-cigarettes, and inhalational agents, and their efficacy in helping individuals quit smoking. The effects of nicotine on the human body are complex and far-reaching. With the knowledge gained from this study, we can take the necessary steps to protect ourselves from the health hazards associated with its consumption. The regulation of nicotine use is imperative, and research for safer alternatives should be prioritized. We can use this information to empower ourselves and make informed decisions about our health and well-being. Chemical properties and metabolism. Nicotine, the addictive component of tobacco, is a clear liquid with a characteristic odor. Composed of pyridine and pyrrolidine rings, this organic compound is capable of being absorbed through various routes, such as oral mucosa, lungs, skin, or gut. Its availability and absorption in the body depend on the pH of the solution, which varies depending on the method of delivery. Nicotine is metabolized in the liver via two phases. In the first phase, cytochrome P450 enzymes catalyze the oxidation of nicotine to form catinin, which is then converted into trans-3-hydroxycotinin by CYP2A6. This hydroxylated metabolite is then glucuronidated and excreted through urine. Other metabolites such as nornicotine, nicotine N-oxide, and nicotine epoxide are also formed and excreted through feces, bile, saliva, sweat, etc. Despite its metabolization, nitrosation of nicotine in vivo can lead to the formation of highly carcinogenic substances such as N-nitrosynornicotine, NNN, and 4-methylnitrosamino, -1,3-pyridyl, -1-butanone, NNK. These tobacco-specific nitrosamines are powerful carcinogens that can cause DNA damage and contribute to cancer development. Interestingly, nicotine metabolism is affected by several factors such as genetics, gender, age, and smoking status. The activity of CYP2A6, the enzyme responsible for converting catinin to trans-3-hydroxycotinin, varies significantly between individuals. In some populations, such as Asians, genetic variations in 2-cypriot-pounds A6 can lead to decreased nicotine metabolism and slower elimination, which may increase the risk of nicotine addiction and adverse health effects. Moreover, nicotine metabolism can also be affected by smoking status. Chronic smokers have been found to have higher levels of catinin and trans-3-hydroxycotinin compared to non-smokers due to increased 2-cypriot-pounds A6 activity. This may explain why smokers tend to require higher doses of nicotine replacement therapy, NRT, to achieve the same effects as non-smokers. Immediate effects and toxicity. Picture this. You light up a cigarette, inhale the smoke, and feel a momentary sense of relaxation. But did you know that nicotine, the addictive component in cigarettes, is highly toxic and can cause serious harm to your body? The immediate effects of nicotine are nothing short of alarming. Ingesting even a small amount of nicotine can cause irritation and a burning sensation in the mouth and throat. This can lead to an increase in salivation, nausea, abdominal pain, vomiting, and diarrhea. But the effects don't stop there. Nicotine can cause an increase in pulse rate and blood pressure, leading to hyperglycemia and an increase in the level of catecholamines in the blood. In severe cases, it can lead to tremors, prostration, cyanosis, dyspnea, convulsion, collapse, and even coma and death. Green tobacco sickness, GTS, is another acute form of nicotine toxicity caused by handling green tobacco leaves. The symptoms of GTS last from 12 to 24 hours and include headache, nausea, vomiting, giddiness, loss of appetite, fatigue, and tachyarrhythmias. While no significant mortality has been reported due to GTS, it can significantly affect the health of workers in the tobacco industry. It's clear that nicotine is highly toxic and can cause serious harm to your body. And the dangers don't stop with immediate effects. Long-term exposure to nicotine can have serious systemic side effects, leading to several health hazards. So, the next time you light up a cigarette or use a nicotine-containing product, think twice about the immediate and long-term effects it can have on your body. Nicotine addiction. Nicotine addiction is a dangerous phenomenon that affects millions of people worldwide. It is a condition where individuals become dependent on nicotine, the addictive component of tobacco. The addiction occurs due to the interaction of nicotine with the nicotinic acetylcholine receptors, which stimulate the reward center and dopamine transmission in the brain. This creates a pleasurable sensation, leading to the craving for more nicotine. The addiction process is gradual, with smokers starting off with occasional use of tobacco products. As time passes, their frequency of use increases, leading to physical and psychological dependence. Chronic stimulation by nicotine desensitizes GABAergic neurons, leading to heritable dependence. Studies have shown this dependence to be transmitted maternally and grandmaternally by epigenetic mechanisms. The dependence on nicotine can be so strong that it can override an individual's willpower to quit smoking. Nicotine withdrawal symptoms, which include irritability, anxiety, depression, restlessness, and difficulty in concentrating, can make it challenging to quit smoking. These symptoms usually peak within the first few days of quitting and can last for several weeks. Various methods can help individuals overcome nicotine addiction. Nicotine replacement therapy, NRT, such as gum, patches, and inhalers, can help individuals deal with the physical symptoms of nicotine withdrawal. Behavioral therapy, such as cognitive behavioral therapy, CBT, can help individuals deal with the psychological aspects of addiction. Combining these therapies can increase the chances of successful smoking cessation. Nicotine addiction is not just limited to adults. It can also affect adolescents who start smoking at a young age. Studies have shown that the earlier individuals start smoking, the more difficult it is for them to quit. Adolescent smokers are at a higher risk of developing chronic respiratory and cardiovascular diseases, along with other health issues. In conclusion, nicotine addiction is a serious condition that affects millions of individuals worldwide. It is a gradual process that leads to physical and psychological dependence on nicotine. Quitting smoking can be challenging due to the physical and psychological withdrawal symptoms, but various therapies can help individuals overcome the addiction. It is essential to educate individuals, especially adolescents, on the dangers of nicotine addiction and the importance of smoking cessation. Effects on metabolism. Nicotine is not just an addictive substance, it is a poison that can lead to several adverse health effects. One of the most significant impacts of nicotine on the body is on metabolism. Nicotine causes a release of catecholamines, which are hormones that play a crucial role in the body's metabolic function. When these hormones are released, they stimulate the autonomic system, leading to reduced fasting blood glucose levels, decreased body weight, and an increased risk of metabolic syndrome and diabetes. Prenatal exposure to nicotine can also be toxic to pancreatic beta cells, which are cells that play an essential role in the regulation of glucose metabolism. The exposure can lead to a decrease in the population of these cells, which can increase the risk of diabetes. Nicotine addiction can also cause long-term effects on metabolism, which can be difficult to reverse. Research has shown that nicotine can reduce insulin sensitivity, which is a crucial factor in the development of metabolic syndrome and diabetes. In addition to this, nicotine can also lead to an increase in blood pressure, which can further increase the risk of cardiovascular disorders. The impact of nicotine on metabolism is not just limited to adults, but it also affects children. Prenatal exposure to nicotine has been linked to low birth weight, which can increase the risk of metabolic syndrome and other related diseases. Children who are exposed to nicotine during the early years of their life may also experience developmental delays and behavioral problems. The effects of nicotine on metabolism are complex and involve various physiological processes. Studies have shown that the metabolic effects of nicotine are mediated through several different pathways, including the central nervous system and the autonomic system. The exact mechanisms behind these effects are not yet fully understood, and more research is needed to understand the full scope of the impact of nicotine on metabolism. In conclusion, nicotine addiction can lead to several adverse effects on the body's metabolic function, which can increase the risk of several chronic diseases such as diabetes, metabolic syndrome, and cardiovascular disorders. Prenatal exposure to nicotine can also lead to developmental delays and behavioral problems in children. It is essential to regulate nicotine use and educate people about the potential risks associated with it. Research for safer alternatives should be prioritized to reduce the adverse effects of nicotine on metabolism and overall health. Nicotine and cancer. Cancer is one of the deadliest diseases that have plagued humanity for centuries. It is estimated that around 9.6 million deaths occurred due to cancer in 2018 alone. One of the leading causes of cancer is tobacco use, which contains various carcinogens. Nicotine, the addictive component of tobacco, has been found to be carcinogenic in several studies. Nicotine can stimulate nicotinic acetylcholine receptors, NACHRs, leading to the formation of carcinogenic nitrosamines. These nitrosamines can cause DNA damage, leading to genetic mutations that can result in the development of cancer. Nicotine can also increase cell division and suppress apoptosis, which can lead to the proliferation of cancer cells. Several studies have found that nicotine can increase tumor growth, metastasis, and chemotherapeutic drug resistance in pancreatic, breast, and lung cancers. In pancreatic cancer, nicotine has been found to induce pancreatic adenocarcinoma in mice model, by stimulating stress neurotransmitters and promoting the growth of non-small cell lung cancer and pancreatic cancer in a receptor-dependent fashion. It also increases tumor metastasis and resistance to gemcitabine-induced apoptosis, causing chemo resistance. In breast cancer, nicotine has been found to cause alpha-9 NACHR-mediated cyclin D3 overexpression, which can lead to transformation of normal breast epithelial cells and induce cancer. Nicotine and catenin have been found in the breast fluid of lactating women, and studies have found that alpha-9 NACHR-mediated mechanism can lead to increased tumor growth, metastasis, and tumor cells resistant to chemotherapeutic drugs. In lung cancer, studies have found that nicotine has a significant role in lung carcinogenesis. Genetic variation in 2 billion cypriot pounds 6, catenin promoting tumorigenesis, nuclear translocation of ARB1 gene, and carriers of the lung cancer susceptibility loci extracting more nicotine have been linked to lung cancer. Additionally, nicotine has been found to modulate the mitochondrial signaling pathway, leading to resistance to chemotherapeutic agents. Nicotine can also act synergistically with other carcinogens to potentially shorten the induction period of cancers. In addition to causing cancer, nicotine can also increase the risk of recurrence and metastasis in cancer patients. The evidence linking nicotine to cancer is compelling and provides further support for the regulation of tobacco and nicotine use. More research is needed to understand the mechanisms underlying nicotine-induced cancer, and to develop safer alternatives to tobacco use. In the meantime, smoking cessation programs and nicotine replacement therapies are important tools for reducing the risks associated with nicotine use. Organ system effects. Nicotine is a powerful chemical that can have adverse effects on various organ systems in the body. From the cardiovascular system to the reproductive system, nicotine can wreak havoc on the body, leading to several health hazards. Let's explore the impact of nicotine on the different organ systems. Cardiovascular system. Nicotine can lead to an increase in heart rate, blood pressure, and cardiac contractility. It can also reduce blood flow in cutaneous and coronary vessels, increasing the risk of hypertension and cardiovascular disorders. Long-term exposure to nicotine can reduce the angiogenic response, making it harder for the body to repair damaged blood vessels. Respiratory system. Nicotine can cause bronchoconstriction and apnea, leading to respiratory disorders such as asthma and chronic obstructive pulmonary disease, COPD. Additionally, nicotine can cause emphysema by decreasing elastin in the lungs and increasing alveolar volume. The effects of nicotine on the respiratory system can be devastating, leading to shortness of breath and a decreased quality of life. Gastrointestinal system. Nicotine use has been linked to gastroesophageal reflux disorder, GERD, and peptic ulcer disease, PUD. This is due to increased gastric acid, pepsinogen secretion, stimulatory effects on vasopressin, and action on the cyclooxygenase pathway. Nicotine also causes smooth muscle relaxation by action of endogenous nitric oxide, leading to decreased tone of the colon and gastric motility. These effects can be extremely uncomfortable and can even lead to hospitalization. Renal system. Smoking increases the risk of chronic kidney disease due to its effects on the renal system. It can lead to increased albumin excretion in urine, decreased glomerular filtration rate, increased incidence of renal artery stenosis, and impaired response of kidneys to increased systemic blood pressure. The impact of nicotine on the renal system can be long-lasting and potentially life-threatening. Ocular system. Nicotine has been linked to age-related macular degeneration and cataract formation in animal models. It has a synergistic relationship with glucose metabolism, which increases the risk of diabetes mellitus and can lead to accelerated cataract formation. The effects of nicotine on the ocular system can be debilitating, leading to blindness and a decreased quality of life. Reproductive system. Nicotine can affect both the male and female reproductive systems. In males, nicotine has been shown to impair the synthesis of nitrous oxide, which is necessary for penile vasodilation and corpus cavernosum relaxation. It also decreases testosterone levels, which can lead to erectile dysfunction. In females, nicotine affects the menstrual cycle by causing hypestrogenic states, which can lead to irregular menstrual cycles and inappropriate cytokine production. Nicotine can also affect oocytes, leading to disturbed oocyte maturation and impaired fertilization. Maternal smoking has been linked to several negative outcomes such as stillbirth, miscarriages, mental retardation, and pediatric asthma. In conclusion, nicotine can have severe adverse effects on the different organ systems in the body. The impact of nicotine on the cardiovascular, respiratory, gastrointestinal, renal, ocular, and reproductive systems can be life-altering and even life-threatening. The regulation of nicotine use is crucial in preventing further damage to the body, and research for safer alternatives should be prioritized. Nicotine replacement therapy, NRT, is an effective adjunct in managing withdrawal symptoms and improving the success of cessation programs. It is important to understand the impact of nicotine on the body and take steps to prevent further harm. Conclusion. Nicotine, the addictive component of tobacco, is a serious health hazard that poses several risks to various organ systems. This review has examined the adverse effects of nicotine on the human body and has uncovered a multitude of alarming findings. From increased risks of cardiovascular and respiratory disorders to reproductive health issues and decreased immune response, it is clear that nicotine is a poison that should not be taken lightly. Regulation of nicotine use is imperative. The tobacco industry has for years been promoting their products to young adults and children, leading to an addiction that can last a lifetime. Stricter laws and regulations on the sales and marketing of nicotine products need to be put in place to prevent such situations from occurring in the future. Research for safer alternatives to nicotine is also necessary. Nicotine replacement therapy, NRT, has been found to be an effective adjunct in managing withdrawal symptoms and improving the success of cessation programs. However, it is important to remember that NRT is still a form of nicotine and comes with its own set of risks. One of the most alarming findings of this review is the link between nicotine and cancer. Nicotine stimulates NACHRs, leading to the formation of carcinogenic nitrosamines, increased cell division, and suppression of apoptosis. It can also lead to increased tumor growth, metastasis, and chemotherapeutic drug resistance in pancreatic, breast, and lung cancers. The adverse effects of nicotine are not limited to cancer. It can have several adverse effects on various organ systems such as the cardiovascular, respiratory, gastrointestinal, renal, ocular, and reproductive systems. Nicotine can lead to increased blood pressure, decreased blood flow, bronchoconstriction, GERD, and impaired wound healing. It can also cause reproductive health issues such as erectile dysfunction, irregular menstrual cycles, and intrauterine growth restriction. In conclusion, nicotine is highly addictive and has several adverse effects on the body. Regulation of nicotine use, research for safer alternatives, and awareness programs need to be implemented to prevent the negative effects of nicotine on the human body. It is time to take action and put an end to the addiction that has been plaguing society for too long.